Greetings, everyone. So, myself, Nevatha from Saveetha College of Physiotherapy. So, I will be presenting on the topic Lumbopelvic-Hip Stabilization exercise with Pilates on inflammatory markers in individuals with degenerative conditions. So, starting up with the introduction, knee osteoarthritis is a common degenerative joint disorder causing pain and functional limitation in adults. So, exercise for lumbopelvic hip core stabilization are a potential effective way to manage the arthritis in the knee. So, these exercises target on the muscles surrounding the hip pelvis and the lumbar spine, improving the lower extremities and the stability and the common biomechanics. So, while Pilates exercise is a bridging between the upper and the lower extremity, it also helps to improve the muscle strength. The combination effect of the lumbopelvic hip core stabilization with Pilates on the inflammatory markers in the knee osteoarthritis remains an inadequate study, thus unstudied. So, thus, the purpose of the study is to evaluate the effectiveness of lumbopelvic hip core stabilization exercise combined with the Pilates on inflammatory markers, pain, and functional ability in individuals with the knee osteoarthritis. So, these are my reviews. The background of the study. Degenerative conditions like knee osteoarthritis causing pain, stiffness, and impaired function. Inflammation plays a key role in the disease progression. Core instability and poor biomechanics worsens the symptoms. Hip core stabilization exercise and Pilates exercise improves the overall biomechanics, muscle balance, and joint stability, potentially reducing the inflammation and enhancing the function. The need of the study. Conventional therapist Conventional therapist studies often overlook the core stability. So there is a research limitation on the combination effect of hip core stabilization and Pilates on inflammatory markers in knee arthritis. Thus, this study addresses the gap between the effective evidence-based intervention strategies and explore their impact on reducing inflammation and improving the clinical outcome. The aim and objectives. Aim. The aim of the study is to find the efficiency of the lumbopelvic hip core stabilization exercise with Pilates on inflammatory markers in individual with degenerative condition. Objectives to evaluate the effectiveness of lumbopelvic hip core stabilization exercise with Pilates on reducing inflammatory markers in individual with neoarthritis using laboratory analysis, and then the on reducing pain in individual with knee arthritis using NPRS, that is the numerical rating scale. And next, on improving the functional activity in individual with knee arthritis using the KOOS scale. Methodology. As it is an pre-post interventional study, a sample of 15 subjects with knee arthritis were selected through simple random study. The participants were recruited from the Saveetha Hospital, and it is an 8-week instructed exercise program consisting of lumbopelvic hip core stabilization combined with Pilates. So it is performed 4 days per week. Each session lasted approximately 30 to 40 minutes, and the exercises were repeated 5 times per session with adequate rest period between set to prevent the fatigue. So, this program includes core stabilization and Pilates based exercise designed to improve posture control, lower extremity stability, and muscle strength. So, both stable and unstable surface were used to challenge balance, proprioception, and also the exercise were adapted according to each participant's ability and tolerance. Okay, as I said in the beginning, pain intensity were assessed using numerical pain scale, and the functional ability were measured with knee injury and osteoarthritis outcome score, which is the SCOO score, and inflammatory markers were evaluated to serum level of TNF alpha and IL-6, which are the pro-inflammatory cytokines. The assessment were conducted at the baseline and also after the 8-week intervention. So these are my inclusion criteria and the exclusion criteria. Inclusion criteria includes individual age between 40 to 50 years, the BMI between 30 to 35 kilogram per meter square, an individual experiencing pain, functional limitation associated with knee arthritis, and clinically and radiologically diagnosed knee arthritis patient were included. And the patient that are willing for 8-week intervention program and provided informed consent. The exclusion criteria includes recent surgery in lower limb, participant with sensory loss and congenital deformity affected in the lower limb. Okay, these are my exercise protocol where it starts from lumbopelvic-hip stabilization twice weekly, 8 weeks, and between each set exercise repetition, 5 seconds of isometric contraction are given to emphasize the coordination action of lumbopelvic hip stabilization. Along with these, Pilates are added on according to the week. And result, as the subject underwent my prescribed intervention, the data collected were analyzed statistically for the pre and post values of NPRS and WHO scale and the inflammatory markers. So the treatment resulted in a great improvement and the difference is statistically significant, indicating that the protocol lumbopelvic hip stabilization exercise with Pilates effectively reduces the pain, improve the functional ability, and lower the inflammatory markers in individuals with knee arthritis. So these are the graphical representations. Um, Discussion. According to my discussion, thus the evidence provided supports a multifaceted rehabilitation strategy that includes lumbopelvic stabilization and Pilates exercise target both a mechanical and systemic contribution to knee arthritis. So this intervention appears not only to improve the functional outcome but also the modulation of inflammatory process, so thereby offering a comprehensive management pathway. Conclusion. And thus my study conclude that lumbopelvic hip stabilization exercise combined with Pilates are effective in managing pain arthritis in individual aged between 40 to 45 years. This exercise program significantly reduced the pain level, improved the functional ability, and lowers the inflammatory markers. The study supports the integration of the lumbopelvic hip stabilization and Pilates exercise as a safe and a beneficial intervention for enhancing musculoskeletal function and reducing the systemic inflammation of individuals with degenerative knee conditions. So these are my references. Thank you.